Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. It is day 29 of the 30-day podcast challenge. We are almost done with the challenge, folks. 30 days to being a badass nurse. Hopefully you've listened to all the tips. Hopefully you've gotten something out of these episodes. And hopefully if you're not already, you're well on your way to becoming a badass ER nurse. Today's tip is from Nisa Hadaway from the Keyword Podcast, and she's got a tip for us for those of you taking care of critical care patients. Take a listen.
Hey Kevin, it's Nisa again. I have really loved your 30-day challenge. I have learned so much. Here's my last tip to share, and it's about intubated patients. So working mostly in the transport environment, when we pick up an intubated patient, we're going to remove them from the bedside vent and put them on our transport vent. And then again, when we get to the receiving facility, we're going to take them off of our transport vent and put them onto the receiving hospital's bedside ventilator. Oftentimes that end tidal or the patient circuit gets, we put it on there, we want it to be nice and tight so there's no leaks. But then sometimes when it's time to remove it, maybe you're taking your patient from the ER to the ICU or whatever, you can't get it undone. It's kind of stuck and sealed on there. And so an ICU nurse showed me a quick, clever trick where she just took a quarter out of her pocket, slid it in between the connection, and then used it as a lever and popped it right off, no problem. So you want to be gentle. You don't want to do a lot of tugging because you don't want to, of course, extubate your patient. So this is the perfect little hack to get that vent circuit unhooked. So thanks for letting me participate. Bye.
Nisa, thanks for sharing your expertise with the group. I appreciate all the tips that you shared. Thanks for being such a generous contributor to the podcast. Everybody else, thanks so much. And tomorrow, I'll catch you on the last day of the 30-day challenge. Have a great shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.